And so today we're going to talk about a case involving a couple different phases of treatment. So this lady came to me because she didn't like the way her front teeth looked. She had some old bonding that was chipping and breaking, but she was also having major headaches and TMJ issues. Her jaw was being restrictive. So when that's the case, what we need to do is we need to give the lower jaw more room, more freedom to move. So we went through phase 1 treatment of moving her teeth out, increasing the radius, increasing more space for her tongue, so she can breathe better, sleep better, and live life better. So as you can see here, this is before we did anything. There are no spaces, but you can see that there's cracks and fractures and some old bonding on her front teeth. So at the end of aligners, that's what these attachments are. It helped control the movement of the teeth. We intentionally created space between her front teeth because we're going to make the teeth a different height to width ratio. Imagine the teeth, if they're very square, they do not look pleasing, so we need to make them taller, we need to make them wider because we wanted to fill the spaces in. What we're able to do is we veneered only her front 4 teeth, but now when we're done and she smiles, the teeth are all in a row. They are wider, they are taller. We'll visit back in and I'll update you on the final photograph where her lip will rise and everything will look really good. Just another successful case and a patient very pleased with the outcome.